Hi, this video is for first responders, doctors, nurses, EMT, specialists, anyone who is on the front lines right now helping with the response to COVID. In this video, I'm going to be sharing with you a very powerful and yet simple and elegant mind, body, nervous system technique that you can use to help yourself reset and get some relief right now. So my name is Jackie Simek, and I am a mindset coach. I primarily work with entrepreneurs, but I'm certified in this tool, and it's called EFT, Emotional Freedom Techniques. Sometimes people call it tapping. And so that is what I'm going to be sharing with you today to help you to get some relief and some reset so that you can continue doing the amazing work that you're doing right now, helping all of us everywhere. So tapping, super simple, and what we do is it's a combination of talking, applying acupressure to your own body, and a little bit of energy work. So the way this is going to work is I'm going to say the words and you're going to repeat them. So you'll hear me say something and tap on a certain part of my body, and you're going to tap on the exact same spot and repeat after me. So what you'll notice in this video is I'm going to say something and then there's going to be a pause. That's where you're going to repeat what I just said. Don't worry, it's super simple. Let's go over the points before we jump in. You're going to see this is so easy and yet super powerful, especially if you're trying this for the first time. People get a ton of relief from this, both in their emotions, their mindset, and particularly where they maybe sometimes didn't even realize they're holding and carrying so much tension and weight in the body. Okay, so we start off and we do a couple statements. Again, remember, I'm going to say the words, so nothing that you need to worry about. I'm going to start off with us tapping on the side of the hand. So it's this fleshy part of the hand, and it doesn't matter which hand that you're doing it to. The weight or the intensity of the actual tapping itself is like as if you were tapping somebody to get by them, right? So you just tap them gently on their shoulder or something, say, excuse me, I'd like to get by. So it's something about that pressure. And then after we spend some time here, we are going to be moving to the top of the head. So the crown of the head, where the eyebrow meets the nose. So on this sort of circular, if you picture like a skull, most of the time I have to tell my clients Day of the Dead, but you guys are first responders, so you know the body really well. So it's where the eyebrow meets the nose on that bone, and then on the outside of the eye, so not the hairline, not the temple, but just on that bone edge, and then under the eye. Now normally we go under the nose, but right now we're going to try to avoid touching that part of our face. And we're going to move straight down below to this fold in our chin. And then coming down to the points of the collarbone, you want to be about 1 centimeter over and under. You're going to find this little pocket. So the bone is curving like this, and you're going to be applying pressure there. And you can do it like this with one hand. You can do it with one hand like on both spots, or children really like to do it with their flat hand. Again, this is super forgiving in the technique. Your body's still going to get a beautiful amount of relief from this. Then coming down to the side of the body, if you're a lady and you are wearing a bra, then right where that ends, so for about 4 inches down on the rib cage. And then if you can come across, there's a point. It should be directly under your nipple. That is the liver point, liver 14, if you know anything about acupuncture medicine. So right there is where we're going to be tapping. Or if you want, you can tap under the chest area. That also works very nicely. And then we're going to go back up to the top and continue in order with our tapping points. So let's tap on what you are feeling right now. From what I hear from my friends that are on the front lines, there is a lot of fear. It seems like it is relentless. People coming in, the amount of grieving, the amount of shock, and maybe there's some self-doubt kind of shoving down your feelings and your emotions so that you can continue to do your job. And so there might be some of that, and there might be some self-judgment of how much longer can I do this? This isn't what I signed up for. This is so emotionally taxing. Doubts about when this is going to end, doubts about administration and leadership and protecting you and having the right supplies. And so there's a lot of worry about some of those things. Could you catch COVID yourself? And what about your families? Are they at risk? So there's a lot that you're thinking about, and in the midst of all that, you're in this high pressure environment to just keep going and doing the best that you can. And so what we're going to do here is really to help you do that, to help you honor the feelings that you may be having or you may be trying not to feel right now, and to allow yourself to really reset and find that strength again to continue forward. All right, so right now I just want you to take a deep breath, a nice deep breath in, and let the exhale be slightly longer than the inhale. Let it be messy. I'll give you a chance to do that again because I was talking a bit there. So nice grounding deep breath in, and let it all out. And I want you to call to mind anything that in particular for you personally is happening right now, is coming to the surface that you're wrestling with emotionally, mindset-wise. Maybe you're feeling this in your body. So where are you feeling any sort of tightness, tension, something that doesn't feel as, I would say, normal and fluid as it typically does? So something that, if you might be just aware of. Lots of times we see this in the shoulders, the upper back, the chest, the stomach. So just take note of where that is in your body, and I'm going to ask you to bring that back to mind in the midst of the tapping. I'll give you a chance to reconnect with that place in your body, but just kind of connect with there right now before we begin. And then I want you to assess yourself on a scale of 1 to 10. This is very helpful because it allows you to see the tapping working. It allows you to see how quickly your emotional and physical state change. So on a scale of 1 to 10, 10 being the most extreme, really, really upset, and a 0 or a 1 being like, this is not something I even think about. So that's kind of your scale. And just see where you are right now, and we'll check back to that when we finish. So let's jump into the tapping itself. Remember, you're just repeating after me and you're mirroring where I'm tapping. So even though these weeks have been unprecedented, it's been extremely hard for me. Witnessing everything that's happening and feeling like I have no control. I honor what I'm going through, and I choose to treat myself with kindness and compassion. Even though I have a lot of fear right now. I have fear for my patients. I have fear for myself. And I have fear for my family. I honor all this fear related to COVID and my job on the front lines. And I choose to love, honor, and forgive myself for any judgments I may have. Even though I'm feeling a whole bunch of emotions right now. stress, anxiety, fear, doubt, resentment, grief. I honor all of my emotions. And I feel them here in my body. And I'm ready to release some of them now. Top of the head. All this fear I have. Anxiety. Doing my job. Seeing this up close. Every day. Helping people. It's so much. So many patients. So much loss. So much grief. I have all this fear. When will this end? When will this become easier? Will I be protected? How long can I do this? I'm exhausted. I'm physically exhausted. And I'm emotionally exhausted. And it's really hard right now. It's really hard to do my job. I feel like I've lost a big part of me. Pushing forward. Trying to be strong. This fight is really hard. And I allow myself to feel all of the fear, all of the doubt, all of the anxiety that's in my body, this place in my body. Just allow yourself to get in touch with that place in your body. I honor all of these feelings. And I allow myself to feel them. Allow myself to honor them. I allow myself the ability to release them. Even though I'm feeling all these emotions, I know that I'm strong. I know that I'm resilient. The part of me knows I can do this. I can continue. I have a calling. I know I'm strong. How can I easily see that I have everything inside of me? All the internal resiliency to continue to serve the people who need me. How can I be more aware of my own strength? How can I easily move forward with more grace, with more ease, with more peace, to trust in myself, to trust in my colleagues, to trust in the administration. How do I allow myself to feel safe in this moment? I allow myself to feel safe. And I feel that safety move through my body, move through my mind, and through my nervous system. And I just invite you now to take a deep breath in and exhale. And just check back where you are with your intensity number. You should notice that it's gone down a little bit, and really the goal is to get to 0 or 1. So you can rewind this and tap again to it, and notice where you had that feeling in your body. See if it's still there, see if it's moved somewhere else, and you can adjust accordingly to what emotions came up for you, what thoughts came up for you, and where they are in your body. This is a nice little framework for you to use, and I know every day you're probably feeling a little bit different. So as long as you're getting in touch with your own emotions, feelings, and thoughts before you start the tapping, it should be really effective. I appreciate you, and I appreciate everything that you do, and know that the whole country, the whole world is behind you right now, and we believe in you, and thank you so much for your service.